Hello, this is Paul Auwaerter with Medscape Infectious Diseases, speaking from Johns Hopkins University School of Medicine. Why on earth might I have picked the topic of measles? I mean, why should we worry about this, especially when we still have subvariants of Omicron circulating, lots of early influenza, respiratory syncytial virus, and even avian influenza, which unfortunately has led to millions of chickens being culled in Nebraska over this past week. Well, I thought I'd give a bit of a personal perspective because 30 years ago, I, as an infectious disease fellow, wanted to study virology and immunology. But at the time, even though HIV had vast importance, I was a bit of a contrarian and worked in the lab of Dr. Diane Griffin at Johns Hopkins. And the reason I thought this was an interesting intersection is at the turn of the 19th to the 20th century, an Austrian pediatrician and scientist by the name of Clement von Perke became famous for a couple of things. One was for coining the word allergy to explain hypersensitivity to horse serum and similar instances. And also he laid the foundation for tuberculin as part of the MAN2 test, otherwise now known as a purified protein derivative skin testing for TB. And he made the interesting observation that in his patients with TB and positive skin responses, that following measles, those skin responses vanished, suggesting that the infection of measles caused an immune suppressive illness. And indeed, this is something that was really the first virus, subsequently identified as a virus by John Enders in many decades later, that this was the first instance of an immunosuppressive virus long before HIV. Although there was a successful attenuated measles vaccine that had become a component of MMR that was 97% effective after 2 doses, and even though measles was vastly reduced in the United States, it remained a significant problem in Africa and countries of low resources, with infants and young children dying after measles, especially after post-infectious illnesses such as pneumonia. And although measles was declared eradicated in the United States in 2000, there have been continued outbreaks from time to time. But the focus was really the fact that measles vaccine, even though widely successful, could only really engender good vaccine responses in children 12 months and older. And since the idea was to find a safe and effective vaccine in infants less than a month old, this was really the task to understand and whether something could be developed safely at that time. And also a vaccine that might not need to be refrigerated, which of course was a big deal to maintain a cold chain, especially in countries with underimmunized children. So many of you are already aware that you need more than 95% compliance or so to really achieve effective herd immunity. And that had been the case in the United States, or nearly so, for quite a while. But with the pandemic, there have been vast disruptions in routine immunizations, both because of not getting healthcare visits, but also a lot of negativity about vaccines, which of course have been building ever since the Wakefield episode, linking it to autism without any clear basis of fact. And also, of course, more recently with the issues regarding SARS-CoV-2 immunization, especially in children. So recently the CDC and the WHO have declared a vast problem of over 40 million people who have missed recommended measles vaccines, with only 71% of populations receiving 2 doses. So they've labeled this as a growing threat and a growing number of dangerously susceptible children. I thought, by way of context, it's useful to just remember what happened in 2014 and 15 with measles having lots of cases in the United States, and the outbreak, especially in Disneyland, where although the index patient was unknown, the strain of measles was similar to what had been circulating in the Philippines. And there were 129 measles cases including among 55% of people who have had some degree of immunization. And over 20% of those 129 people required hospitalization. So this is just one instance, so that if there's indeed problems not only in the United States but elsewhere, suddenly there could be a case for yet another worry about viruses that could be quite preventable. Vaccine is highly effective, but it's really in the context of that herd immunity. Anytime you have lots of cases, and this is true in the Disneyland instance, it's not fully protective from infection anymore, although it may help avoid severe infection. So the idea really is to help take preventative measures and, of course, reinforce efforts not only here in the States, but also worldwide. And this is just something that, again, 30 years ago, I had made the estimation that I thought measles really didn't have the legs for a long-lived career and pivoted elsewhere. But as a reminder, in the pre-vaccine era, there were 500 deaths per year in the 1950s and 60s, 48,000 hospitalizations, 1,000 bouts of encephalitis, from more than nearly 500,000 infections. So, of course, we won't get back quite to that era, but it is something that can cause vast disruptions. And I think all of us would like to get back to normalcy. So understanding the benefits of vaccines in the context of dangers is as important as ever. And certainly if any of your patients are hesitant about getting routine vaccines, it's hard to bring them because many of them are steadfast in their efforts. But this is something that I think hopefully we won't come to see, but to be prepared, because many of us, including myself, have in the United States never seen a case of measles. So hope that's some food for thought, but also some background in history that might be helpful as well.